Hello, it's really a fantastic pleasure to be here, and I want to thank the organizers of the second annual Women's Heart and Vascular Symposium to include this really interesting topic on equity in women in cardiology and leadership for your lunchtime symposium. Thank you so much. I wish that I could be there in person, and I look forward to actually meeting each and every one of you in the future in the third Women's Heart and Vascular Symposium next year. But for now, let's talk about equity. These are my disclosures, but honestly, my biggest disclosure here is my huge passion in equalizing the playing field for women. I've done this for the last 15 years. Just based on my own experiences, but I think that's my biggest disclosure because I'm a woman in interventional cardiology, one of the mighty few. I think about us as raft of others. Think about when they are all swimming together, how much stronger they are. And this is us having to kind of swim in very deep waters, very cold waters of cardiology. But if we all stick together, we will stay warm, we will make progress, and we will make huge, huge difference in the care of our patients with cardiovascular disease. I know that. This is one of the most wonderful, wonderful subspecialties of medicine. Unfortunately, we're not able to attract more women to this field for many reasons. It's really not a very family-friendly subspecialty. And importantly, I think of all of the very important differences of this male-dominated subspecialty where we've been for long under-recognized, unseen, and unpromoted or not promoted to what we really deserve to get. So I think it's very important for us to reach out, empower, and then hopefully benefit women in cardiology by creating institutional and organizational women in cardiology mentorship and sponsorship groups to make sure that we give good advice and attract more women, building virtual communities for our women in cardiology, empowering them with having more women in leadership roles, really, really important. If you don't see any leaders, why would you want to go into a subspecialty that's dominated by men and that men are always leading and women, there's no place for you as a leader? Encouraging open communication amongst all of the women in cardiology, empowering us to promote diversity, advocate for other women. And then of course, this will benefit all of us. This is really, really important. I love this paper. And if you haven't seen this paper by Garima Sharma, who did a beautiful job working with the Leadership Council and Diversity Inclusion Task Force of the American College of Cardiology, that have made this a very, very important priority for the next coming years. And they really mean it. And I can tell you that as a member of the Board of Trustees of the American College of Cardiology, this is really, really important for ACC, as I have seen it be important for AHA as well as ESC. But these 10 recommendations to enhance recruitment, retention, and career advancement for female cardiologists is fantastic. So it's such a good read. Let me take you through some of those recommendations, because she felt that there was urgent action needed for implementing creative, multi-pronged approaches to address the many real and perceived barriers for women's full participation in cardiology. This is really an important call to action. So for employers, institutions, and practices, if you don't do this, you're going to be behind very, very much so. And I think you can share some of these with your institutions to develop programs that supports career flexibility and work-life integration, recognizing that implicit bias, it really, really is there. Everyone needs to be trained on implicit bias, and you must adapt a zero tolerance for workplace harassment. A harassing work environment is really not a place for anyone to tolerate at all, and providing clear parental leave policies and radiation safety and lactation rooms for women. These are not, we should not be embarrassed to ask for these things. And female cardiologists need to know that their employers, institutions, and practices must have these for them. The academic, divisional, and departmental leadership have to develop mentoring programs and increase women applicants to their fellowship programs. We see many, many fellowships who are not having women attracted to those fellowship programs. And now the ACGME will be looking at these as an important variable in whether or not you're actually doing a good job in diversity and inclusion. And of course, for accreditation agencies, you got to work with ACGME to provide clear family leave policies and flexible training pathways. There are important, very important recommendation for research funding, because for years now, women are underfunded. We see it in the NIH funding. There has to be gender equity in review processes and committees. And now I do know that there are projects going on at the NHLBI as well as the entire NIH in blinding the reviewers to noting whether or not the applicant is a woman or a man. So it's going to be really interesting to see those data. I'm looking forward to looking at that. And then, of course, for professional societies, collecting and publishing data on sex inequities in funding, publications, promotion, and compensation, really, really important. And the scientific journals is making sure that there's equity in that peer review process. Most often, we see very, very low numbers of women being first author or senior author. And this disparities in authorship is what is keeping women from promotion and leadership positions. So we need to really, really take a look at that. Are reviewers being tougher on female first authors? And I think the data shows that. And of course, for senior women cardiologists, for those of you in the audience listening to this, you have to work and pay it forward. And you must improve the climate for women and mentor and sponsor the next generation. This is only done by creating a supportive culture through collaboration and mentorship. And I think there's no question that fellows in training and early and mid-career cardiologists can also be a part of this important next level of working together to advance female cardiologists. For men, we need you more than ever before, especially those of you senior men who have enjoyed the leadership positions. We want to make sure that you can easily and immediately recognize and intervene when there is a harassment and bullying. Also, we want you to mentor most of these women. And of course, the partners, whatever the gender of the partner is, sharing in the domestic work and childcare, elder care responsibility, and changing those social norms that gives women first, second, and third, always the responsibility to females. Of course, all of this will free us up. We won't know what to do with all of our time if all people will do this and equalize the playing field. If you take a look of what's going on in Europe, you will see what they're doing. The European Association of PCI is a group of women who are lobbying for better representation of women in the interventional community. They're listed here. I hope you recognize some of these amazing women in interventional cardiology. They call themselves the invisible army of women, that they want to make sure the mission of the European Association of PCI, which is sort of like the SKY group there in Europe, that they are working, and their mission is to make them visible so that they are seen and they are heard. I myself have spent the last couple of decades really working on this, and believe wholeheartedly that my responsibility as someone who's in a leadership position and has enjoyed the benefit of wonderful publications and ability to now be a full professor, to pay it back, to make sure that other women are also enjoying this benefit. And also, I love cardiology and interventional cardiology, and I'm amazed that more women are not attracted to this wonderful subspecialty. As a result, we have co-founded with my colleagues, Marie-Claude Maurice, professor in France, in Paris, and my very, very close colleague and collaborator, Ms. Rebecca Ortega, as a managing director of Women as One. Our work here is, and our only one and only aim that we have, is to broaden and promote the global talent pool in medicine, not just in cardiology, but in medicine, by providing unique professional opportunities to female physicians. And as you can see, we're really working for female physicians as a whole, but we needed to immediately get to this house of cardiology because it was really, really broken. Of all of the subspecialties, we are last. In 2017, only 10% of the subspecialists in cardiology were women. This is lowest than any other subspecialty in medicine. By 2019 and 20, we're now up to about 16%, but that's really, really moving at a turtle speed. I want to see it represented at 35 to 40%. Why not? This is a wonderful, wonderful subspecialty, and we should be able to bring in more women. Our work is to promote talent in medicine. And the talent of women just is getting completely lost within cardiology, where there's a huge lacking ability to attract these women. So what do we do at Women as One? There are several reasons that we started to focus on cardiology. The female cardiologists are 3 times more likely, I bet you didn't know that, than men to experience discrimination due to parenting responsibilities. Women cardiologists are 37% less likely to become full professors than men. There are no standards, absolutely none, for parental leave, return to work, or radiation safety practices for pregnant cardiologists. We're working on that. We already have a full tutorial for our pregnant cardiologists online. And women cardiologists make $2.5 million less than their male counterparts over their career. Think about if you have a career of 30, 35 years and you're constantly being paid over time, that amounts to a lot of money that women are missing out on, especially in cardiology. So we aim to broaden and promote the global talent pool in medicine by giving these unique opportunities. And we believe that by doing that, more women will get into the leadership positions, the pay gap will go away, hopefully, and we will be able to promote and really fix the house. So we got a lot of fixing to do. And our goals are to amplify by developing compelling digital content to showcase talented women, fortify by strengthening the pipeline of women leadership in the healthcare, and unifying the house of medicine to set metrics. And these metrics have to be driven by both diversity and gender for inclusion. And we support efforts of women in medicine and with aligned organizations and match these qualified women to important opportunities and include women and ideas from industry outside of medicine. So we're really, really kind of developing this, I would say, a platform, a place, a home for all female physicians to feel unified together. We have this wonderful talent directory that's now up to about 850 registrants, and from 60 plus countries, 11 subspecialties. We urge you all, if you want us to help you, if you want to join this mission, this goal, go to the Women as One website, which is womenasone.org, and please register in the talent directory. We ask a lot of questions because in the directory, we are matching you with opportunities. So the more we know about you, the more we'll be able to help you. And this is really, really a fantastic, fantastic opportunity for all of you. The directory has had huge impact. The Cardiovascular Clinical Trial Forum has reached out to us to get us a list of qualified female speakers for their planning. And that's not just CVCT, it's TCT, AHAT, ACC. We send these qualified speakers to everyone. And we basically were able to give, for this particular request that came from the Cardiovascular Clinical Trial Forum, we gave them 47 speakers, 15 countries, and within a week, 14 speakers were selected, 93% for new faculty compared to what they had before. And we were able to change the venue of CVCT to a much more friendly and more diverse faculty. And they were very welcoming. So the fact is that they really, really care about making sure that there are, so the talent directly could help. So please go in there and put your name in there. The other thing we did during the COVID-19 pandemic early on, when we were all suffering, and I think this was sort of in mid-April, where it was awful in New York. And what we did is the entire country was on lockdown, and we did this symposium of finding grit and grace to lead during COVID-19, having some of these amazing speakers with an incredible track record. And then, of course, we followed that a month later with sex, gender, and COVID-19, as well as we donated what we could to delivery of N95 masks to frontline workers. Our idea was that we needed to be very open about the impact of trauma, especially for women during COVID, women physicians, where they also have to take care of their families, as well as really working with some of the professionals to handle how do you dig deep and find the grit and the grace to lead. And we really had a fantastic showing. This is all online. You can go and watch them if you ever feel down and you want to really, really lift yourself up. I told you that we're working on this pregnant cardiologist, and this is the radiation safety in the practice of cardiology. This is an incredible, incredible program, webinar. It's all a set of guidelines on what to do, everything you need to know about radiation safety to keep women very much engaged, and to, of course, promoting safe and fair practices and policies for pregnant women cardiologists. The other thing that is incredible is we've been giving away all the money we raise, we give away. We don't keep any money, we give it away to women. And in 2020, we had our Escalator Awards launched. We had 70 applicants from 14 countries and 7 subspecialties. And we awarded these 5 amazing women, 2 from the United States, 1 from Canada, 1 from South Africa, and the other from the United Kingdom, $50,000 each through sponsorship of these amazing supporters. And these women are making a difference and escalating to the next level of leadership. That application process is ongoing for 2021, and we're about to choose the next 5 winners for 2021. We're really, really excited. We now have lifted this from, instead of 5 awards, to 9 awards in 2 categories: research awards for women academic cardiologists, as well as mentor match awards, where mentors are matched with fellow awards, where they work together and promote one another and help one another to get to the next level. So the mentor's job is to be matched to a fellow and hopefully work together to make that happen for that important fellow. Finally, I think the CLIMB programs that we have done has been incredibly, incredibly useful with increasing, promoting, and improving the training and the skills of women interventional cardiologists, led by Nadia Sutton and Dawn Abbott. This program has done incredible topic tracks with the best in class faculty, helping to further promote and train women who are interested in those important procedures. We also just started the One Fund, investing in our female entrepreneurs. This is an investment for the future of medicine. This is a vehicle which helps women raise funding for their ideas and wonderful ideas. If you contribute to this fund, we get the next entrepreneur to go to the next way to hopefully succeed and go forward. We're very, very excited about this fund. and believe that there'll be amazing innovation coming out. We're also starting our global research network around the globe, developing capabilities of the talent directory and training and identifying women investigators so that you could also have the chance to be a site PI or maybe on executive committees of clinical trials. So really, really wonderful things that we're trying to do. And we have an incredible group of women who are working at Women as One, who will be promoting all of these programs. And I've written their emails and contact information. Please feel free to take a picture, reach out to these women, and they will help you. So finally, I know that we will equalize the playing field. It's already happening. I feel it, and I see that it's coming through, not just because of Kamala Harris, but because of every other things that are going on around us. If we don't, we'll be in trouble. So I know that we will succeed, and I look forward to working with all of you as one. Thank you.